Back with another episode of Pottawattamie County Roots. Hi, I'm Todd Studer, and we have a special guest in studio today. We're going to meet Shelly Coon with HealthMarkets. Good to see you.
Thank you. Good to
Thank,
see you.
thank you so much for being here. HealthMarkets, what is that?
Well, we're an insurance agency that specializes in all types of health insurance and life insurance and dental and vision and everything you need to keep yourself healthy.
Usually, when we're thinking about health or thinking about insurance, period, and especially at my level, it is car and
Right?
home insurance, and that's about it. But we're talking health insurance and different things like that that you help people with.
Yes, right. So we work with Medicare coverage, which, if for those who don't know, Medicare is for people who are 65 and older, or if you are on disability or have permanent kidney failure, different scenarios, then you can possibly be eligible for Medicare when you're under 65. But typically that starts for people who are 65 and older. We also offer marketplace coverage, which is known as the ACA coverage, also called Obamacare. It gets called all kinds of fun names.
It does.
It all means the same thing. It's the health insurance that comes through the government. There's short-term coverage, there's indemnity coverage because the ACA plans can be very expensive. They can have high deductibles. So we like to have alternatives to fit everybody's needs because not one shoe fits everybody, not one size is for everybody. So, and then of course we need dental coverage, we need vision coverage, life insurance, the one thing nobody wants to talk about, but everybody needs. Um, and then there's all types of cancer plans, heart attack plans, indemnity policies. So lots of different varieties.
Let's start with where you started at with on the Medicare side, because we have a rapidly growing population over the age of 65.
Yes.
So that means more and more folks are going on to the Medicare plan. What are some of the uh, things that you help them navigate as they are trying to figure out what is right for them?
It's a really good question. Medicare can be very complicated. The feedback that most people share with me is that I make the process super easy to understand because I walk them through step by step. So, to answer your question, the first thing we talk about is when is the right time to start Medicare? Because if you're still working, and a lot of people still work after 65, they'll work to age 70. So, if you're still working and you like what you do, you don't necessarily have to go on Medicare. It depends on how many employees are at your place of employment. So the first step is to just visit with everybody to understand what is it that you need and when. And then we talk about the parts that break down Medicare. So when somebody says, I'm told I have to have Part B, what does that mean? Well, Medicare is broken into two parts. You have your Part A, which is basically being in the hospital. And Part B is everything else. It's all your outpatient services. And because Medicare doesn't cover everything, we have to get something else to go with it to help cover the deductibles, to cover the 20%. And so there's lots of different options that go with that. And so we'll talk through what's best in your situation, what's in your budget, what kind of doctors do you have, what medications are you taking. It's not a one conversation process. It takes several phone calls, several visits just to make sure you're getting the right information.
I'm trying to imagine myself sitting in that chair as you are talking with them, and what would be going through my mind is there's options. I thought it was just okay, I'm on Medicare now, and
Right.
that's it. I don't know anything about it, and for a person to try and navigate that all by themselves, of course, there are some Einsteins out there, but
Right.
but still,
But the most
yeah.
part, yes, most people are come to me, they're very confused and they don't know where to start. So we talk through that whole process. You also have to apply for your Medicare in some cases. If somebody is receiving a Social Security check prior to turning 65, that person will automatically be enrolled into Medicare.
So they won't even be doing anything, and it just
It-
automatically puts them there.
Correct. They automatically get enrolled into the Part A and the Part B. But everybody then has to decide what they want for their extra coverage. Well, let's take the scenario somebody decided to keep working at 65, and at age 68, they decided now it's time to retire. Maybe they have a spouse that's now turning 65 and they were waiting for that spouse to turn 65.
Sure.
So then they only have to apply for the Part B in some cases. So that's all done through the Social Security Administration. And there's a couple of different steps. And today, or as early as last week, they just changed their website and the process on how to do that. So rather than making somebody just go and figure it out, I walk them through that step by step. And I tell them, this is where you have to go. Here's the documents that you need. There's a special document that an employer has to fill out. And then we upload those or attach them to the online application. And if all else fails, they can still drop it off at the Social Security office. But part of that process is just walking through them step by step, because nobody likes to just show up and go, I don't know what I'm supposed to do. What documents am I supposed to need?
Well, we're talking about government here, and the government will never be a sponsor of mine, so I'm okay with saying this. There's going to be changes.
Right. All the time.
So from one year to the next, and maybe even more frequently than that, things are changing. And how well are we navigating that? I'm just thankful that you're out there, because we need people with knowledge to be able to help us with all of this.
Well, thank you. Yeah, I've been in the insurance world for about 20 years, and the last 15 or so specifically working with Medicare and now some of those ACA policies. And you are right, every year there's change. So Medicare has an enrollment period in the fall. It's October 15 through December 7, but it's only for certain policies. The advertisement that we see on TV and in the news makes it sound like it's for everything, but it's not. It's specifically for prescription drug coverage, which is known as the Part D, and it's for what we call Medicare Advantage policies, and those usually include the prescription. So it's kind of like your old work insurance or your employer coverage, where they give you an opportunity once a year to review what you have and then change it if needed. There was a law that was passed about 4 years ago, and it's taken the last 3 years for those changes to go into effect. And so now we're really starting to see a significant change in the prescription drug coverage and how the government wants you to choose a policy. It's becoming very hands-on for the consumer, but if you don't know what you're doing, you can make a huge mistake. And you can't change your prescription drug plan after January 1. So if you don't choose the right policy, you could find yourself in a really bad situation and not have your medications covered.
Or something new comes up afterwards too, that, I can only imagine that while things are changing within the policies, there's things changing within people.
Right.
They're dealing with something later that they weren't, maybe they didn't even anticipate at the beginning of the year.
That happens all the time. And that's a great question. So maybe you're healthy today and in June you have a heart attack and now you have to take a really expensive medication. So what do? Well, hopefully we have a policy in place that's going to cover that, or at least give you alternatives. I feel like the benefit of having an agent is that you have your go-to person. Anybody can go to the website and pick a plan, but are you choosing that plan based on premium, or are you choosing that plan because it fits your needs? And that's where the insurance agent still has a value. And even though a lot of things are changing with Medicare and any of the government policies, wanting everybody to just choose something from a website, what a huge mistake that could be if you didn't know to look for the right information. Does that make sense?
Yeah.
Okay.
It definitely does. Looking for something fun June 27th? Head to Quaker Steak and Lube in Council Bluffs for Wheels of Courage from 11 to 2. Check out classic cars, hot rods, muscle cars, and more while supporting a great cause. Registration is only $20 and all proceeds benefit the Jenny Edmondson Foundation Cancer Center Charitable Patient Care Fund. Judging starts at noon with awards at 1 o'clock, trophies in 17 categories. For details or to register, visit jehfoundation.org. Service Master Restore by Schmader knows it can be hard to get things back to normal when you've suffered serious property damage due to flooding, fire, or smoke, and that can oftentimes lead to mold, and you may be left with all sorts of questions about how to get your home or business back to normal. It's easy. You give Cindy Schmader a call with Service Master Restore by Schmader. Her phone number, 402-339-9911. Are you working more with those 65 plus on the Medicare side or more on the ACA side, or maybe it's even? I don't know. Is there like a balance there, or higher population that you typically work with?
At the moment, because I got my start in Medicare, that's still going to always kind of be my go-to. I feel like I just connect really well with that population. Um, I get referrals all the time. I just had somebody on my way over this morning call from Louisiana looking for some help. Um, because everybody looks for somebody to hold their hand. But now mom and dad have a 26-year-old that's coming off of their insurance because at age 26. And so because I help mom and dad, now they're asking their son or daughter to call. What do you have for marketplace coverage? She doesn't start her job for 6 months. Is there a policy we can cover her on for the next 6 months? So, yes, so then I started getting into the marketplace plans or the short term plans, or for people under the age of 65 that just need some type of health insurance. Um, Last week, I helped a young man. His mom and dad were clients of mine, and they just realized that their 30-year-old son hadn't had health insurance for 3 years. He's a 1099 contract
Mm-hmm.
employee and never goes to the doctor, so doesn't see the value in having health insurance. But yet, mom and dad were telling a story of one of their employees got hurt, not on the job, but got hurt. She ended up losing her arm. And so, of course, then being mom and dad, they were very concerned when their son didn't have health insurance. So I was able to help him find something.
You kind of moved right past an important point there. I think that we should highlight that we're talking to an audience right now, mostly in Southwest Iowa.
Right.
However, if they know someone in another state somewhere, you're licensed in a lot of different places that you can be able to help people.
That's right. I have licensed in 40 out of the 50 states. I used to have all 50, but just decided that was probably too much and didn't need to be in Hawaii or Alaska. Although I have helped people out there.
Yeah.
But yes, I can help people all across the country. There are certain products that are state specific when you're under the age of 65, but on the Medicare side, Medicare is exactly the same in all 50 states, so that makes it easy for me to help no matter where they're at.
Okay, let's talk about the ACA side or the Obamacare or whatever label that they're giving it during an election cycle.
Right.
That also can be difficult to navigate, even, for a younger person jumping on there. What am I supposed to do with this? I don't know.
Right. And I have one. My family and we are on one of the ACA marketplace
Mm-hmm.
plans. I'm self-employed. My husband is self-employed. We have 2 children. So we really didn't have a choice. The marketplace plans have very good intentions. They were created to be able to help people who normally can't get health insurance because of their health conditions. So the intent behind it is very good, so that everybody has the opportunity to have health insurance. The downside is they're really expensive. And to try to reduce those premiums, the government came up with a tax credit. The tax credit tries to reduce the overall premium of your policy. And so, what they look at, there's a formula that they use. They're going to look at how many people are in the household, the ages, the adjusted gross income, and based off of that information, you may or may not qualify for a tax credit. So, if we use a very simple example and say you want to choose company XYZ for your health insurance because your doctors are in their network, your medications are covered. If that policy has $1,000 monthly premium, but your demographics and your income say you qualify for a $400 tax credit, you subtract off the 400 from the 1,000 and now your monthly premium is $600. So that's how the tax credit works. And the intent, again, is to help reduce the premium so that everybody can have health insurance. But last fall, during tax season, the tax credit, the extended tax credit, was eliminated. And so now we're back to a tax credit that not everybody qualifies for. So for 2026, the premiums went really high. In some cases, they went up 50%.
Wow.
And a lot of people lost their tax credit. So it's very unfortunate. We all need health insurance of some sort, but there's a limit on what we can afford, right? You and I had that conversation.
Yeah.
There's a limit, and everybody has a limit. So we have to have alternative options. When this doesn't work for somebody, what does work? And so that's why, at least with our agency at HealthMarkets, we work with multiple companies. We have multiple types of policies, so that way we can try to customize a plan that fits in your budget. Because in my theory is, it doesn't matter how good the coverage is if it doesn't fit within your budget. And everybody has to have some type of coverage, because I don't know about you, but if I end up in the hospital and have a $500,000 hospital bill, there's no way I could afford that without a health insurance policy.
There's things happen, and everything is fine until it's not.
Right.
And for most of us, it's not an if, but a when.
Right.
That eventually something is going to happen, and we can gamble with that time. And I know that many of us, and I'm guilty of it, I have done it too, that, okay, well, I feel pretty good. I'm pretty healthy. But I know that things can come on very, very rapidly. And there's a lot going on in here that we don't see. And that is, you talk about that having options and having something in place, which for me, it's how do you figure out what that is? Because that's why somebody like you is so important, because you've been there, you've heard the stories, you've walked down that path with so many people that you have a different kind of experience and a different vantage point than a lot of us.
Right. And I, on a personal note, I can't ever pass the health questions. I have a health condition that doesn't allow me to get the plan that has the lower premium. I have to have the ACA plan. And I've always said the hardest part of my job is when somebody calls me and says, "Remember when we talked about that? Did I put that policy in place?" And I have to tell them, "No, you didn't want to spend the extra dollars to put that policy in place." That's a really hard conversation to have. Or the life insurance that nobody ever wants to talk about, right? The old saying, death and taxes.
Yeah.
Right? We all know it's going to happen. So let's be proactive about it. Let's talk about it. Because if your spouse passes away, do you want your spouse to stay in the same house that you're in? Or does she have to sell that house to be able to go get something that's more affordable? It's the same thing with health insurance. If you get a $100,000 bill from the hospital or from the cancer treatments or whatever the condition happens to be, do you want your spouse and your children to live the same lifestyle they have today? So that's another really hard conversation to have. I try to make sure we talk about it with everybody, because again, that to have somebody call you and say, "Did we put that life insurance policy in place?" I would much rather say, "We did.
Yeah.
And here's a check for $50,000. Or here's a check for $100,000. And they can take a deep breath and go, "Oh, I'm going to be okay for a couple years." That's a much, much better conversation to have than when it's the other way around.
I had a talk years and years ago with a friend of mine who was in that industry and sold life insurance, and he explained it to me this way, and I wanted to get your opinion about it, that he was recommending a much higher number for younger people, because obviously when you're younger, typically life insurance is more affordable.
Right.
But because let's say that his income was $75,000 a year, so he recommended putting a policy into place that when invested can then pay out in order to be able to maintain that lifestyle so that income can stay.
Hmm.
So that was his reason. Now, this makes a lot more sense for younger people because when you get to somebody my age, putting a policy in at $500,000 or something like that starts to be a little cost prohibitive. But for younger people that might be watching,
Yeah,
it makes a lot more sense.
it does. I mean, there's so many different options, and everybody's situation is different. So, what if you're a young person who just bought your first house and you have a $300,000 mortgage? If you were to pass away, somebody's got to pay the $300,000, right? And do you want your spouse? I mean, usually when you buy a house, you have two incomes a lot of times, and you're using both incomes to pay that mortgage. Well, now you're down to one person, and you're down to one income instead of two. So, not every situation's right for everybody. I think it's really important to understand what they're looking to cover. How much debt does somebody have? Do you have a couple kiddos? Do you want those kiddos to go on to post secondary education, whether that's trade school or college? Or maybe they just want to go buy a business and start a business. Maybe they are a welder and they want to start their own company. So everybody's needs are different. I don't think there's a one size fits all for everybody. But yes, having something to replace that income would be important. Um, the conversation that I've been having more frequently was, or has been, on long term care coverage, because it kind of goes, again, kind of
Yep.
back to that Medicare, but it doesn't have to be Medicare. You know, um, how, how many young people do you know that have been in a car accident and now they're in a wheelchair? Or they can't work because they're on a disability. I mean, people go on disability for a lot of things. They could be getting migraines at a young age and can't work. So, what happens when you can't take care of yourself anymore and you either have to have somebody come into your home to take care of you? That could be at age 25, that could be at age 45. There's no age limit on when you can no longer take care of yourself. So that's another conversation we have, is long-term care coverage. And long-term care, in the old days we called it nursing home coverage. You and
Hmm.
I are about the same age. We always called that nursing home. They don't call it that anymore because there's more than just nursing homes. There's assisted living and there's senior living and there's home health care and home care that comes into the home to take care of those kind of things. So a lot of different options. For the younger crowd, we'll call them the under, maybe you're under age 40, under age 45, you are in a prime of your life, I think. You've got kids that are growing, almost teenagers possibly. You're planning ahead for the future. So why not plan for the what if? We would never think about going without homeowners insurance. We'd never drive down the road without having car insurance, right? Why would we never think about having health insurance or life insurance? It's just, to me, it makes it full circle.
It's that
Does that
thing
make
that
sense?
it does. And I'm also thinking, because I can hear the arguments,
Sure.
that typically these are internal. We don't verbalize them.
Right.
But if I do that, I'm just inviting that into my life. Well, no, it's going to be there.
Right.
We all have an expiration date. Every single person walking the planet. And I don't look at that as depressing. I look at it as this is just the way things are.
Yeah. To me, it's planning ahead.
Right.
I'm not a spontaneous person by nature. I am a planner. I like to know things are in place and ready there when needed. Um, and I think everybody just needs to maybe think outside the box a little bit and ask themselves, well, what if? I just helped a client with a young person. He's in his early 30s, no family, no kid. I'm like, not married, no kiddos. His life insurance was $17 a month for $50,000. One of the biggest arguments people say on, or objections on, why they don't talk about life insurance, there's an assumption out there that it's crazy expensive. Well, $17 a month, what is that? Two Starbucks a month, maybe? Two Starbucks coffees? Um, maybe a lunch. If you can afford a lunch out or a dinner out, you can afford $17 a month on a life insurance policy in your early 30s.
You've been at this for 20 years. I'm sure you've seen everything and there's no new surprises, right?
Well, every day we learn something new, especially with the government. There's never
Very true.
never a dull moment with the government policies.
Primrose Retirement Community in Council Bluffs believes home should be a place of comfort, connection, and care. From personalized support to engaging daily activities, everything they do is designed to help residents live fully and confidently. At Primrose, that's their priority to put the quality of their residents' care and daily needs at the top of their list each day and every day. It's not just about where you live, it's about how you live. Learn more about life at Primrose by going to primroseretirement.com and then contact Jamie Bush at Primrose and discover a place that truly puts people first. Your home for all natural health solutions in Southwest Iowa is Bambi's Green Acres Natural Market. Serving the area since 1997, Bambi is located at 805 South Main Street in Council Bluffs and has a wide selection of vitamins, supplements, essential oils, herbal remedies, and a lot more. Staffed with over 37 years of experience, Bambi is putting health back in your hands. Explore your wellness options online at bambisgreenacres.com. So, as you are talking with folks and sitting down, is there a lot of aha moments for you when you're visiting with someone and that's the feedback that you're getting? Because I'm having them right now, sitting and talking to you. So I'm guessing that it's probably a common occurrence. You're sitting across the table or in a living room with somebody and, oh, I never looked at it that way.
Yes, very much so. You can see when that light comes on and they go, "Oh, now I get it." And so if that's yes, you're right. We do get a lot of aha moments. And for me, what's most rewarding in this industry is when somebody comes to me and says, "Thank you. I'm so glad we put that policy in place because," and then they share their story. Um, I can think of, like you said, I've been doing this a long time. So
Mhm.
there's a lot of things. The first story that comes to mind is a couple in rural Oklahoma was just calling. We usually call and check on everybody at least once a year, make sure everything is going okay. She told me that her husband had had a heart attack 6 months after we put his policy in place, had to take the life flight to the local hospital, and then took him on to the more regional hospital. And she said, "You know what, Shelly? I never got a bill. We were able to have all of the care that he needed, and we never got a bill for any of that." And
Wow.
she was just calling to say thank you. That is, I mean, that breaks your heart, right? I mean, it brings a tear to your eye. There's multiple times I have tears. I'm an emotional person. Um, but for somebody to be able to say, thank you, that saved us a ton of money. I'm so glad that we had that. Or when somebody calls and says, I retired a year ago. I wasn't feeling well. I went to the doctor and now I've got the dreaded cancer. I was able to go to the cancer center that I needed. I was able to see the doctors that I needed. And all I had to pay out of my pocket was this small deductible. I'm so thankful that I had that policy. That is what makes my job rewarding. That's why I show up to work every day. That's why I do what I do. Because when I tell people that I sell insurance, most people look at me like, why would you want to do that? That is the most boring job. That why would you want to do that? And it's because of those reasons.
No, it doesn't. I can only imagine the stories that you've heard over the years and the feedback that you've gotten over the years. It has to be a very powerful experience. And to be honest, before meeting you, I didn't know that help navigating ACA was even a thing.
Oh,
I honestly didn't know.
did you think you just had to go to the website and choose something?
That's what it had. That's what I did
Yeah,
when I had ACA coverage. Yeah, I just went and all right, well, this okay, and a lot of it was based on how much it was going to cost.
right.
That was really the only criteria that I knew to base it on.
Well,
So
that's how we
yeah,
shop for a lot of things is
yeah.
by price. And have to until you have a medical experience when you have a $7,000 deductible and you go, oh my God, I have a bill for $7,000. And then, oh, by the way, after your 7,000, you're going to owe another 40% until you get to $15,000. Yeah. Talk about an aha moment. And you're like, oh my God, how am I going to pay this? Like, why is it like this? So unless you've gone through an experience or had a family member that's gone through an experience, you don't, nobody, none of us understand how bad that is. I would compare that to maybe like a house fire. You don't realize how much stuff you collect and how much stuff you have to replace until you go through something like that. And it changes your whole perspective on protecting yourself and protecting your family.
When you're meeting with one of those folks, is it typically in person? Is it an online? Is it a Zoom call? I mean, how
All
is
of
that
the
connection happening?
all of the above. So locally here, of course, we can meet in person. I have an office in West Omaha. I also have an office out in Avoca, Iowa, which is where I spend most of my time. Um, but for all my people that are not local, then we just do it over the phone or through Zoom. So it's whatever, today there's so many different ways you can communicate with people. It's usually what their preference is. I personally have learned that when you're visiting with somebody further away and you do that over the phone, people tend to listen better. Um, because they can't focus on what's behind you. They can't focus on the dog barking in the background,
Right.
right? They are focused on what you're saying. But sometimes I miss that one on one connection. So when I'm working with somebody here locally, I love to visit with them one on one. If they want to come to my office, fantastic. Otherwise, I meet with people in their homes too. It just depends on what they're comfortable with.
Well, I'm hoping that we can continue to have you back and learn more about some of the different things that you do, and maybe dive into some specifics
Sure.
with that, because there is, while it may not be universal for everyone, it is going to be for some people because it all exists out there.
Right.
And especially, in our part of the world, you talked about cancer, and it's fairly common knowledge that Iowa has one of the highest cancer rates in the country. I think it's the only place where the rate is going up, I think, is what I heard.
That's what I
Yeah,
thought I saw on the television, on the TV stations. Just within the last couple of weeks, they were talking about how Iowa has the highest cancer rates.
right. And these are things that we have to be proactive about, and,
Right.
and to know that being able to get this covered and getting the checkups and doing all of the things, because typically the earlier you catch it, the better chance you have. So having those things in place, it hits any age.
Right.
It
They
doesn't
say
matter.
everybody knows one, if you have three people sitting in a room, one and three of us are going to have cancer. One out of the three of us are going to have cancer. That's a pretty scary number. And so let's be proactive and let's make sure that when you get that diagnosis, not if, but when you get that, wouldn't you rather have somebody hand you a check for $100,000 or 300,000 or whatever number you choose, rather than you writing the check to the hospital or you writing the check to the, why would you want to use your retirement money or all your savings to pay for that? I don't know the exact number, so I'm not going to quote a percentage, but most people don't even have enough savings to pay their 1 month of mortgage.
Yeah.
That's really scary if you don't have something to help cover that. So I feel like um, sometimes insurance maybe gets a bad rap a little bit because people just have this assumption that it's going to be crazy expensive and I'm not going to be able, it doesn't cover anything. I hear that a lot. It doesn't cover anything. All right. Well, tell me what you mean by doesn't cover. Do you get your medication? Yep. I can pick up my medication. Well, did you have to pay for it? Yes, but it wasn't $5. Well, if your medication's $500, you're going to have to pay more than just $5 for that medication. So let's figure out where the breakdown is and maybe get a better understanding of what's covered and what's not covered. And then we get to that aha moment that you talked about before.
How do people find you? How are you making that connection? So if someone is watching this and they say, "All right, I need to talk to Shelly," how do they do that?
Yeah, great question. So my phone number is 402 807 3685. You can call me, you can text me. My email address is sacoon@healthmarkets.com. You can find me on Facebook, you can find me on LinkedIn, you can find me on Google. You just have to put in Shelly Coon Health Markets, and I'm the only Shelly Coon Health Markets that's out there, so it's pretty easy to find me. Um, yeah, and word of mouth, you always running into somebody that says, Oh yeah, I forgot to ask. So those are the best places to reach me.
Well, and I'm sure that having an office in Avoca, I love that town.
Thanks.
It's great. It's got they have one of the best main streets of that I've been on, and great places to eat and get coffee and everything else. So
Thanks. We're
very
glad to have you.
very grateful that you came over today to fill us in a little bit on this. And as I said, we're going to dive deeper and learn some more specifics and get some for instances,
Great.
if you will.
Yeah.
I'm looking forward to that too.
Yeah, fantastic. Maybe this fall, when we get close to the enrollment periods, we can come back and start talking a little bit more detail about
Yeah.
what's coming up for next year
That would be very good
on both
information to have.
sides.
Exactly. It'd be very good information to have too. So
Yeah, I'd
again,
love to.
this is Shelly Coon, and she is with Health Markets, and there's my camera right there. And we will be back very soon with another episode. By the way, if you hit like, share, follow, whatever those buttons are on the platform that you're watching this, it helps spread this information out even further that Shelly just shared with us. And that's just your way of being able to help us. It's completely free. It doesn't cost anything to click those buttons on your social media or on YouTube. My name is Todd Studer, and we will see you back here again very soon.